Welcome to our conversation every Monday. And today we are going to talk about, sickness and health. The teacher, Alfredo, he didn't feel so well in the last days. So this is a very good chance to talk about it. So, teacher, welcome. Today we're going to talk about, health. And I know that you didn't feel so well in the last days. So can you tell us about your symptoms, teacher?
Sure, teacher. And first of all, a very good morning to you, teacher, and always a pleasure to speak with you.
Yeah,
This topic on health and probably wellness is something that's very, very useful and very important. Of course, all of us have to think about our health.
yeah, that's true.
And there's a famous expression in English, and which basically says, health is wealth.
Mm. Wow, that's nice.
So of course, that shows you how just important our health really is.
Yeah, health is
And
well.
health
Nice.
is wealth. It rhymes, and even if you have all the money in the world, if you
Yeah,
don't have your health, if you don't have good health, you're not going to be able to enjoy
your
your
life.
life.
That's true.
So
Yeah,
this is a useful expression. I always think of it sometimes and try to keep it in mind. But yeah, to go back to your original question, teacher, yeah, you are correct that probably the past few weeks, actually, I wasn't feeling well. And I had I had a very severe
cough. Very
a
good.
cough,
Cough. Mm-hmm.
cough when
Oh,
we cough, and I had a lot of chest congestion.
chest congestion. Let me ask you, teacher. Cough. Is it a noun? But it's also a verb, right? So
That's
you
correct,
can
teacher.
say I was coughing,
I was coughing,
and I had a cough.
or I had a cough.
Perfect.
That's right. And of course, it's one of the most common types of illnesses that we all encounter.
Yeah, that's true.
I don't think I don't know anyone who hasn't had a cough throughout their life.
Yeah.
So, so my problem was I had this cough, but it was a little bit severe, and I
Severe.
had congestion, and I had something that's called phlegm, PHLEM,
Phlegm.
phlegm,
Yeah.
and it's also known as mucus,
Mucus.
MUCUS.
Yeah. In Spanish, we
And
say flema.
okay, so there's a
Flema.
similar,
Yeah.
right. And
That's
I
and that's part of the congestion, isn't it?
yes, I knew it. I knew that that was causing my congestion.
Okay.
So I knew that in order for me to get rid of the problem, I have to get the phlegm out of my system.
Yeah. The phlegm out of your system. Wow, that's very
Right.
nice.
Right. And when I spoke to my doctor, he gave me some medicine to help me do this.
What kind of medicines did you get? Antibiotics?
I got antibiotics, but more simply, you may be familiar with Robitussin cough syrup.
Yeah, that's kind of a Sprite.
I think I have my bottle here,
Oh, okay.
and it says here you I don't know if you can see it very well. It says expectorant.
Expectorant. Yes, teacher. Expectorante.
So this Robitussin is very good because it helps to get that phlegm out of your system.
Yeah. You spit it out.
You spit it out. Yes. Basically, you try to spit it out, and that helped me a lot
Okay.
because before I couldn't get the phlegm out. I had what was considered to be a dry cough.
Oh, yeah, the dry cough. And
No,
how long have you been taking this medicine, teacher?
I would say about 10 days, teacher.
10 days already.
Yes.
Oh,
Along with some other medicines. So I'm not sure if I may have acquired a virus
Maybe.
which caused this cough and chest congestion.
Is there a virus around your place? In your city, your country?
Yes, yes.
What is the
And
name? Called?
I'm not sure of the name,
Okay.
but you know, I was talking to some friends of mine in the States, and they reported the same types of problems.
Wow.
So it's kind of international.
Yeah. Did you have any other symptoms, teacher?
Yes, teacher. I did. I had a runny nose. I
Running,
had a
running
runny
nose.
nose,
Yeah, running nose.
and I had a fever
Fever?
as well.
Okay, fever.
So
And how was your temperature?
uh
Did you
it-
measure your temperature?
yes, it was probably about 3 degrees above normal,
Normal,
above
average.
average. Right. So sometimes when we use the word fever, basically what we also mean is to have a high temperature.
A high temperature, yes.
They're kind of synonymous.
And that's very dangerous because when people have fever, it's because there is an infection, but mostly.
Right. So it does need to be monitored. So as going back to what you said, I had a cough, I had a cold, I had a fever, a runny nose. I also had body aches and pains.
Body aches, that's
Body
important.
ache,
Body aches, like
my
backache,
shoulder
stomach
hurts, my
ache.
back hurt. Yes.
Okay, that's coming from the bones.
Right,
Dolor de
right.
cuerpo en los huesos. Body ache.
The body aches and pains. I had a loss of appetite.
Loss of appetite. Oh, that's also important.
Another
Pérdida de
indication
apetito. Loss of appetite.
where
That's
I
also
didn't.
important.
I think I must have lost a significant amount of weight these past few weeks
Yeah.
because I'm not eating much. But now, thankfully, my appetite is starting to return,
Oh, nice, teacher.
and I'm eating more and again.
You're eating more.
So those were kind of the most of the general symptoms that I encountered, teacher,
Yeah.
when during these past probably close to 2 weeks now.
Did you go to the doctor?
I had a phone consultation with my doctor.
Phone consultation. Okay.
And I talked to him and I described my symptoms, and he wrote me a prescription
Okay.
for antibiotics and other types of medicines. And I was able to bring that to my pharmacy, and I was able to purchase the medicines.
Do you have an insurance to buy those medicines, or is it for free, or
I have
special
insurance, but for something that small, usually it's just out of pocket, teacher.
Okay, teacher. Do you have to buy the antibiotics through the doctor?
If a prescription is needed,
The prescription is needed.
you do. But if it's something
You do.
that's not needed, then they call that over-the-counter medicine.
Over-the-counter medicine, yes.
You can buy that anytime.
Yeah, anytime.
In the US, you go to CVS or Walgreens, you can buy any over-the-counter medicine without a prescription.
Perfect, teacher. And are you eating anything special at home? Kind of juice, fruits, vegetables, or
Yes, I'm drinking more tea.
more tea?
More tea, which kind of cleanses the system.
Okay.
Can
you repeat that word? Cleanses the system?
Oh, sure. Cleanses.
It's like
the system.
Like clean.
Cleaning. Yes, or we could just say cleaning the system.
Okay, okay.
So tea is very good for us in that way.
Yeah,
Green
tea,
tea,
definitely.
whatever flavor you may like.
Yeah.
Um, and I'm just drinking more water and taking a lot of vitamin C, as you can imagine, which helps when you have a cold.
Okay, teacher. Vitamin C, it's important.
Yes, vitamin C, vitamin D also, by the way.
Vitamin D. Hmm.
Yeah.
Are you
So
doing exercises? Not yet.
um, I try to walk a little bit every day. Teacher, now that I'm kind of feeling a little bit better,
Are
I
you feeling better now?
I am. I am. I'm not 100% yet, but probably I'd say 80 to 85%.
85%. Okay, teacher.
And on the
Wow.
way.
On the way, yes, teacher. Wow. Thank you so much, teacher, for sharing with us all your symptoms and everything and talking about something which is very private.
Oh,
It's health,
not at all, teacher.
but it was very
Not,
nice from you to hear from
so,
you all the symptoms that you had. And although all this situation that you were able to be with us with the English lessons and everything, and I really appreciate it. So thank
oh, always a pleasure, teacher. And again, it's just reminds all of us to please, if I could tell anyone who's listening, to all of you, the students, please always take care of your health.
yeah, that's true. That's true. You have
Never
to visit the
neglect your health.
doctor, and yeah, we have to do our regular checking
Uh,
and even
and the
when
combination of diet, exercise as well.
yeah,
So please, if we all take care of our health, we'll have many longer days
that's
to
true.
come, many more years, teacher.
That's true, teacher, definitely. Okay, teacher, thank you so much. And I really hope
Always a
you
pleasure,
guys
teacher.
like this lesson, this conversation lesson that we were talking a little bit about health and the way to feel
Well,
better.
yeah.
Thank you, teacher. Thank you so much. Bye bye.